All right, let's dive into something you probably don't think about every day, your kidneys. These two little organs are absolute powerhouses, working around the clock as your body's master filters. They're doing so much more than you realize. But what happens when these incredible filters start to break down? That's what we're going to explore.
Check out this number. A whopping 37 million adults right here in the US are estimated to have chronic kidney disease, or CKD. To put that in perspective, that's about 1 in every 7 adults. It's a huge number for a condition that, honestly, just doesn't get enough attention.
And here's the real kicker, the part that's truly scary. 9 out of 10 of those people have absolutely no idea they have it. Why? Because chronic kidney disease is a silent operator, especially in its early stages. You don't feel it until the damage is already done.
So here's our game plan for this explainer. First, we'll cover what your kidneys actually do. Then, we'll look at the 2 main ways they can fail, one fast, one slow. We'll get into the biggest threats, walk through the 5 stages of decline, and finally, talk about what happens when those filters need some serious backup.
Okay, first up, let's give these unsung heroes the credit they deserve. We're calling them master filters for a very, very good reason. Think about this. Every single day, your kidneys are performing this incredible, non-stop balancing act. They're pulling waste out of your blood, making sure your body has just the right amount of water and crucial minerals like sodium and potassium, and even keeping your body's pH levels perfectly stable. This whole process is called homeostasis, and honestly, it's what allows the rest of your body to function at all. Now, when we say kidney disease, it's not just one thing. It really has 2 very different faces. One is like a sudden all-out attack, and the other is a much slower, creeping decline. First, you've got acute kidney injury, or AKI, and the name says it all. It's acute, it's sudden, we're talking about a massive drop in kidney function that happens in just a matter of hours or days. It's often triggered by something specific, like a bad infection, severe dehydration, or a major injury.
And then there's the other side of the coin, the much more common one. Chronic kidney disease, CKD. This is the complete opposite of AKI. It's a slow, quiet, and unfortunately irreversible loss of function that happens over months, or more often, years and years.
So, if you put them side by side, the difference becomes really clear. AKI is sudden and scary, but the good news is, with treatment, your kidneys can often recover. CKD, on the other hand, is a one-way street. It's a slow, permanent decline. You can manage it and slow it down, but eventually it can progress to the point where you need serious medical intervention to live.
Okay, so we know the 2 types of kidney disease. But what's putting our master filters in danger in the first place? Let's get into the top threats.
So, what are the big culprits? What's actually causing all this damage? Well, it's a combination of long-term health problems and more immediate events. You can really think about the risks in a couple of different buckets. For that slow burn of chronic kidney disease, the 2 biggest drivers, by far, are diabetes and high blood pressure. Over years, they just hammer away at the tiny, delicate blood vessels in the kidneys. Then for acute kidney injury, the causes are more sudden. Things that cut off blood flow, like extreme dehydration, direct hits from certain medications, like NSAIDs, or even a physical blockage, like a massive kidney stone.
And this points to something so simple but so incredibly powerful. The source material makes it clear that even for healthy people, just not drinking enough water can reduce blood flow and cause real acute damage. The advice is simple. Shoot for 2 to 3 liters of water every day. It's one of the easiest things you can do for your kidneys.
All right, let's get back to that silent progression of chronic kidney disease. How do doctors track a disease that you can't even feel? Well, they use a simple staging system.
It's all broken down into 5 stages. Now, in stage 1, your kidney function is actually fine, but you have known risk factors, like diabetes. By the time you get to stage 3, enough of those tiny filtering units in the kidneys are damaged that waste starts to build up in your blood. And here's the thing, through all these early stages, you probably feel totally normal. It's not until you get to stages 4 and 5 that things get really serious. At stage 5, your kidneys just can't maintain that crucial balance anymore. That's called end-stage kidney disease, and it's the point where you need treatment to survive. And this, right here, is why this disease is so sneaky and why early detection is everything. Because you feel fine, you don't know anything is wrong. That's why if you have those top 2 risk factors, diabetes or high blood pressure, it is absolutely critical to get screened every single year. A simple urine test can spot the earliest signs of damage long before you'd ever feel a symptom. So that brings us to our last section. What happens when the journey reaches stage 5?
What happens when those master filters just can't do their job anymore?
When a person hits end-stage kidney disease, they need something called kidney replacement therapy, or KRT. This isn't a cure. It's a way to artificially do the job of the kidneys to keep that person alive.
The two main types are both forms of dialysis. First, you have hemodialysis. This is the one you probably picture. It uses a machine, an artificial kidney, to filter your blood. It's super efficient, but it usually means going to a clinic several times a week. The other option is peritoneal dialysis. This one's pretty cool. It actually uses the natural lining of your own belly as the filter. It gives you a lot more freedom since you can do it at home, but it does come with a higher risk of a certain kind of infection.
But there's a third major option, a kidney transplant. This is where a healthy kidney from a donor is surgically placed in your body. While dialysis keeps you alive, a successful transplant can give you a shot at a much more normal life. And the data doesn't lie, kidneys from living donors have the absolute best chance of long-term success.
So we'll end on this thought. Your kidneys work for you 24/7, performing millions of tiny critical tasks without ever asking for a thing. Knowing your risks, managing your blood pressure and blood sugar, and simply staying hydrated, those are the best things you can do to pay them back. So the real question is, what can you do for them starting today?